What is going on, guys? Welcome to another episode of the Masculine Health Solutions Podcast, where I am joined by Dr. Paul Gittens, who's going to give us a lowdown on men's sexual health. Tell us about things that we obviously probably assumed we were taking care of, but probably could focus on more. And Cindy, who's also involved with the Xersizer, it's a penis pump that I think is extremely beneficial for men and something that we should probably be paying attention to earlier. And of course, as you guys all know, in my journey, it's something that I didn't really start to integrate into my life until about 5, 6 years ago. So it's something that I think is extremely beneficial. And I am just super honored and super happy to have you guys here. But first and foremost, Dr. Paul Gittens and Cindy, how are you guys doing today?
Doing wonderful. Thanks for having us both on. Been really excited to be here, and I know we both are. Can't wait to start talking about men's health and some penile health.
Nice.
Thank you so much for having us.
Oh, honestly, the pleasure's mine. Because the thing about this audience is that whenever it comes to anything related to penile health, everybody's super engaged. Right. Everybody's just like, yo, man, I want to make sure I don't lose it. The older I get, and I'm 35 now. And, the more I read into statistics about testosterone, fertility, and, the more I talk to everybody in regards to that, it seems as though it's something that's starting to get worse and worse. But I like where you guys are coming from with the Xersizer and how it's something that we should start paying attention to earlier. But one thing I did want to ask you, Paul, is just, I always have this question. I'm like, how do you get involved with urology? Because it's kind of like, as a kid, I don't think you were like, you know what? I want to grow up and focus on men's health and work on penile health. How did that kind of get started for you?
Well, CJ, actually, when I was 5 years old, I did want to focus on that. I'm joking. Well, I first got introduced to healthcare from my mom. My mom's a nurse.
Oh, nice.
And, she worked long hours, long shifts. And, she always kind of promoted health in the house. She also promoted, doing the best you could in school. And then so from there, I went to med school. And at med school, I had no idea what I wanted to do. I mean, I could have been, a plastic surgeon. I could have been an internal medicine physician. But through medical school, you go through a lot of different rotations. Mm-hmm. And one of the rotations that I did was urology. And when I got into urology, it was like the burning bush, sort of, right? It's just, I got to talk to men about sexual health. I got to be sort of a voyeur and like really understand what was going on, not just with prostate cancer, which we deal with in urology, but also with sexual function. And I also do a lot with female sexual function as well. So it was the same thing. So from there, during my residency, I really focused on sexual health. Anytime I was at a location where there was like a world-renowned, urologist that focused on sexual health, I was right there. And then so after my urology residency, I did a fellowship, and a fellowship is extra training, specialty training in men's sexual health and reproductive health. So I do a lot with male infertility. From there, after leaving fellowship, I joined a practice, and then I started running a university program out in New York, where I saw hundreds and thousands of patients with men's sexual dysfunction, which I don't know, something just happened to him, I think. Men's sexual dysfunction and sexual health. And then soon after that, I opened up my own practices. I'm here in Philadelphia, New York, and then in Allentown, PA. And our whole practice is just dedicated to men and female sexual function and wellness.
Nice. And I mean, obviously, it's kind of one of those things where you kind of, as you grow older, you realize there's actually issues here. And, your interest, I guess, starts to get piqued into it the more you start to learn about these things. But the other question that I had in regards to that was, now that, you've obviously matured, it's not just like you're a kid looking into urology and you're like, oh, I want to do that. But what is one of the things that you're finding that's kind of really affecting men, in regards to their sexual health and penile health? What is it that you're seeing out there that's really affecting us?
So just in general, when it comes to our penile health and sexual wellness, the things that have kind of always affected our health, right? So there's like diabetes, right? There's high blood pressure, there's high cholesterol. Our diet has really changed over the last like 20, 30 years. And then there's a lot of environmental influences as well, such as like pollution, plasticizers, these things the plastic that we're drinking, all these things, plastic bottles that we're drinking for our water, all these things can affect our sexual wellness in some degree, and they can ultimately affect our erection quality.
Yeah. And I mean, that's usually the one recurring theme whenever I talk to anybody who practices medicine is just like, dude, guys don't come in until they're completely fucked. It's like, it's not working anymore. And buddy's like, I'm having a hard time getting it up. I'm like, I'll go see the doctor now.
But just stop you there. You're absolutely right. But we're seeing a lot more patients that are trying to be proactive
Awesome.
with their sexual health. So it's not like before, like 5-10 years ago. You're right. It's like, their erection quality is down. They've had multiple failures. They're about to get divorced because, they feel insecure about their penis and all these other things, relationship issues. But now guys are coming in and they kind of want to biohack. They want to kind of get ahead of things in terms of their sexual health and their erections.
Which is honestly something that I think, like my generation, I'm 35 now, and I think that a lot of the guys that are around my age now are a lot more open to it. Where I think, like, the dudes from like my dad's era are just like, no, man, we're men. We don't talk about this. We bottle this up and we pretend it doesn't exist and we drink some alcohol and we're good.
That's right.
Whereas I think, now a lot of the guys are looking into this stuff and they're just like, wait a minute, I don't really have to suffer in silence. I can do things to kind of get ahead of the eight ball and make sure, I don't have to suffer or look for a remedy later on in life. And you mentioned diet, which is one of the things that I think is really important. It's crucial. Like, I focus more on just the fat loss side of things and helping people get into the best shape ever. But how crucial do you think diet is when it just comes to making sure that, you don't suffer from erectile difficulties or any other ailments in regards to sexual health?
Yeah, I think there's two major lifestyle things that you can do to help with your penile health. And one of them is diet, right? We know that diet and exercise, those are the two.
Mm-hmm.
But in terms of diet, there's been plenty of studies that show the leaner your diet is, the better you're eating, the better your penile function is going to be. So there's a lot of data on something called the Mediterranean diet, which I'm
Yeah.
sure you're familiar with, right? So fish, grains, like decreasing your meat intake. When patients are placed on a strict Mediterranean diet, then they see a benefit in their erections.
Yeah.
So diet is extremely important. It's one of the things that we can do every day to really focus on our sexual health, right? And exercise. Exercise is also really, really important, right? The better your cardiovascular health is, the better your endothelium. And I don't know if you talked about that on your show, but that's the inner lining of the blood vessels that actually help to increase that blood flow going to the penis. The better, the more you're doing that, the better off all that's going to be.
Interesting. Yeah, I mean, for me, it's like I like to always I love exercise. That's the easy part. I'm not gonna lie, but for me personally, like I can eat like crap all day, every day, and that's kind of why I started the show. And I got to hold myself accountable, man. That's why I got my fitness pal. And I'm like, oh man, I can't eat ice cream anymore. Well, I can,
Yeah.
but not to the same degree that I used to before, or eat, Burger King and all that kind of crap. Even though as I old, as I age, I'm not really craving it as much. But I know that for a lot of guys, it's like you're in a pinch, you're just going to grab some Wendy's. I had a client who told me that. He's like, hey, you know what? I got a Baconator, this, that, and the other. And sometimes, I mean, I think when we're unconscious about how badly we're eating, we're almost unaware of the effects that it's going to have long term. And it's one of those things that's kind of like a big lifestyle factor that I think is crucial in regards to us actually changing. So to your point, I think it's like super, super important that we actually, cut out as much of the processed foods as possible. But I also wanted to ask you in regards to that, like, because you mentioned blood flow, and I know that's a big key factor when obviously it comes to penile health, erectile health, and just overall physical health, like in general. But what are some of the foods that we're eating that are actually just blocking us, that are causing cholesterol and other things like what's it called, along with like the plaque buildup and stuff in our arteries and all that? Like, what are foods that we should just say, hey, you know what, this is just not for me, I should just cut it out completely?
Yeah, so it's probably the foods that especially around this time of season,
Christmas
like
foods.
if I go out I'm in my office right now. I'm just in my personal office. But if I go out into my patient waiting room, I have nothing but cookies,
Oh.
pretzels. I have all those holiday treats that we get because people love us and they want to share their affection and show us how much they appreciate us. But those are the things that, you can have a cookie here or there, but those are the things that we want to try to avoid all year round, right? And so,
Yeah.
you can treat yourself, but let's not eat those things every day. Let's stay away from the baconators. Let's try to be a little more conscientious about our choices. And I find that even myself, if I'm hungry, if I get home late at night from work and I look through the cupboard and the first thing I see, I'm eating, right? It doesn't matter what it is, right? But I
Yeah.
think if we're a little more conscientious and if, it's hard to do, I understand, but if we can kind of sort of meal prep or at least think about what we're going to be eating before, right? Then we're
Yeah.
going to be a little more conscientious as opposed to being starving when, and then you're hungry and then you're just going to, the first thing you see, you're going to eat. Right. And so
Yeah.
we got to really be conscious about that. But yeah, so, and for me, and, I don't eat a lot of red meat. I don't eat a lot of steaks. I'll have maybe 2 or 3 steaks a year. I'll go out with my friends, and I don't want to be, I don't want to be the guy that's not eating the steaks. So I'll have like 1 or 2 a year when I'm going out with my guys. I try to stay away from the wings, and trust me, I'm a big Eagles fan down here in Philadelphia. But
Yeah.
the wings, the thing about wings is that if you think about it, the ratio of fat and skin to meat is really
Yeah.
low, right?
Yeah.
And so, that's the bad thing about wings. And they're always fried and they're always like dipped in like the best sauces and
Oh
everything
God.
like that.
Yeah.
You want to lick your fingers, but the wings they're not great. So if you like to eat chicken, then if you're having chicken breast, maybe take off the skin. All those little things that we can do really add up, right? And so it's gonna at least prolong the amount of time before you're gonna have to see somebody like me.
Yeah. Which honestly is kind of something that, most people do want to avoid because it's like, I don't want to get to that point where it's like I'm having these issues and circulation is kind of an issue and I got diabetes and this, that, and the other. And I think that obviously, honestly, I think it does come down to a lot of the choices that we do make. But sometimes it's kind of hard to hear that, it's like you are responsible for some of the things that are going to happen in your body, if you make the wrong decisions over and over again. However, the one thing that was kind of leading into was when you see guys that come in that haven't really, I guess, taken care of their sexual health or their erectile difficulties via, having the right diet, taking care of the lifestyle factors and come and say, hey, Paul, can you hook me up with some Viagra? Can you give me some Cialis? What usually happens when you start kind of band-aiding and remedying the I guess their issues without actually taking care of like the fundamental things that are actually contributing to why they're getting erectile difficulties and stuff? Like, does the band-aid effect, does it really work, or does Viagra even have an effect? Like, what happens to these guys?
Yeah, so CJ, my whole practice is dedicated to sexual medicine. So when you're seeing someone like me, then we're doing a whole workup. We're looking
Excellent.
at everything, right? And so that's where I think we're a little different. So obviously, and everybody's got time constraints in their office and physician. I'm not saying I'm the best physician in the world or anything like that, but since we focus on that, when a guy comes in to see me, we do a history, like an extensive history. We check blood work from growth hormone to testosterone to estrogen to anything you can think of what has to do with the penis.
Nice.
We do
Yeah.
nerve testing, um, and then we do a Doppler ultrasound where we're looking at blood flow. I mean, we're doing everything. So when a guy comes in, they're fully worked up. And so when we do choose a treatment regimen, then it's going to be one that's directed on,
Interesting.
we talk about lifestyle, we talk about diet, we talk about all those things. But obviously, the person's coming to see me for a reason. They want to get treated, right? And
Yeah.
so we provide like a specialized treatment program for that particular person. And so, everybody says, "Oh, what do you do for this? What do you do for that?" It really depends on that particular person. What's the reason that person has problems with their sexual health? And we
Yeah.
zero in on that, and then we treat them. So we do use Viagra for some of our patients. And when you understand about the erection, some of it, and like the whole process of the erections and what it does psychologically, what it does, to dopamine and all these other things. So we use Viagra and it does help. I don't consider it really as a band-aid in all situations, but sometimes we use it as a confidence booster, right? So some guys are they're full of adrenaline, and so when we're stressed, we make something called adrenaline. And what adrenaline does is it actually starts to take blood flow out of the penis because your body wants to go into this fight or flight response, right? And so what Viagra can help with is increasing that blood flow. And then when a guy starts getting good erections, then the adrenaline levels can go down, and then they're more likely to have better erections. Does that make sense?
Oh yeah.
So but some guys need a little Viagra. Some guys, the blood flow is just it's just too low, and they just need a little boost.
Interesting.
Or they may need like core wave or PRP or boat. There's a number of things that we do. But I also like to add in like penile pumps.
Yeah.
And so penile pumps, in my opinion, really help with erectile function. It helps to kind of increase the blood flow going to the penis. It has so many benefits for guys that have ED. We know there's a lot of research behind guys that have had their prostate removed, and so we use it with that. But also, as we mentioned before, how guys are being a lot more proactive about their erectile function. So we kind of use it also as exercises for the penis.
Yeah, man. And I mean, honestly, like I said before, it's one of these things that I think Ben Greenfield is probably one of the first dudes that really popularized it in the biohacking scene, where he was talking about how he got a combination. I believe he got the P shot, and then he used gain wave acoustic therapy on his penis as well. And then he followed that up with obviously, training his penis in a penis pump for like, I think it was a couple weeks after. And he just talked about the growth, the expansion, the blood flow, everything just kind of got improved. And it's interesting too, like the one thing I want to commend you on that I feel like I'm seeing a shift in medicine, man, where every doctor I'm talking to is like, bro, we're not just about giving out pills anymore. We're looking at it more from a global perspective. It seems like everybody's utilizing all the tools that you guys have at hand now. Whereas before it would have been just kind of like prescribe something, get out of my office. But now it seems like in medicine itself, it's like you guys are all taking the time to understand the patient from where they're coming from. Because you mentioned the psychological factors, which I don't think was something that was taken into consideration 10 years ago. So he should be okay. Just go on your way. You talk about lifestyle factors, you're talking about diet, you're talking about everything. So I commend you for that, man, because I think, you guys are changing the game, man. So I think that's spectacular. And the one thing that I think is excellent about the penis pumps is you guys are educating people early. Would you recommend it for somebody like myself who's like, yo, I'm 35, I'm kind of, getting older there. If I was to use a penis pump, how often would you recommend, me going about using it?
Yeah, when we talk about erectile dysfunction, right, or erectile health, when you look at the statistics, right, we see that guys that are 40 years old have about a 40% chance of having erection problems, right?
Wow.
And when you look at guys that are 30, it's probably going to be between 20 and 30%, right? So there's a number of guys that are your age that are starting to kind of see the changes in their sort of erectile capacity, right? And so maybe you're not getting up with as many morning erections as you used to, right? Or maybe it's taking you a little longer to initiate sex, or maybe you're not maintaining the erectile function throughout sex like you used to, right?
Yeah.
So obviously for those guys, but also for guys like yourself that are being a little more proactive about things, because we do know that we're getting good health and better health to the penis.
Yeah. That's interesting because yeah, man, it's one of those things that I don't want to lose it. I enjoy my sex life. I'm trying to enjoy making sure that, I'm maintaining the best health possible. And I mean, one of the things that got me started down this road too was with like male enhancement, where it was more about the expansion and the growth and stuff, which I know hasn't really been proven like any clinical study. I think Dr. Judson Brandeis, who I was talking to, talked about how you can actually enlarge the penis with, a combination of the P shot and penis pumping and stuff. So I mean, the science is starting to be developed around it, right?
Yeah, I mean, when you look at prostate cancer patients, because a lot of penile rehab, really, the research really comes from that. So we know after prostate cancer surgery, then we see a shortening of the penis,
Yeah.
and we know that with the pump, we actually can see an expansion of that. So that data is there that we will see an increase in length, but those are patients that have had surgery, right?
Okay.
Obviously, we've been using like pumps and PRP and all these things for the last, I would say, 7, almost 9 years,
Mhm.
and we do see an expansion of girth and some length with just pumping and PRP. So we do know that it is helpful. When you look at studies where they're looking at like oxygen levels in the penis after pumping, so we do see an increase in some of the oxygenation levels, especially if right after pumping compared to when you like some guys if they're going to use a band or something. So
Nice.
some of that data is already out there, but you just got to have to extrapolate it from some of the clinical studies of like of prostate cancer and radiation to the pelvis. So
Interesting.
so yeah, but it's interesting. Like so, the pump, before I got on today, I wanted to see like when was the first pump used. So CJ, when do you think the first pump was mentioned?
I think it was like 1835, I think, because I
Yeah,
researched
you're
it.
close.
Is it something
You're
like around that,
close. You're
right?
close.
Yeah.
Yeah. It was
Oh,
1874.
it's
Can you
close.
believe that? What are they doing in 1874 thinking about their penis, right? But yeah, so it's been the technology's been out there for a long time, and obviously the pumps back in 1874, they don't resemble what we're using today. But the
Yeah.
whole idea of, people being more penis aware and focused on erection and erection quality. I mean, we've been thinking about this for centuries. So
Yeah.
as long as there's been a penis with a guy, I think guys have been thinking about how can we like enhance our sexual function. So it's not a new thing.
Oh, 100%, man. Because I remember I looked at that exact model and I'm like, bro, I don't know if I would trust putting my penis into like a glass cylinder, having that thing crack and it's got like brass and whatever around it. I'm like, well, it looks pretty old school, but the dude behind her is probably like, it is now time for thy to pump thy penis. He's just gonna
That's
band it,
right.
with like old school talk. But I to your point, I'm pretty sure people have been messing around and figuring out different things. And it's funny too, because I was watching this like mini documentary on YouTube about I think it was Togo and Benin and the Batamarimba tribe, where it's kind of like one of the oldest male enhancement practices is they'd get some herb, they'd crush it, they'd be like, all right, cool, now it's time for you to become a man. And it's like the first penis extender ever used. And then buddy
Oh
had to
man.
wear it for like the next couple months. I'm like, that does not look comfortable. But at the same time, we're in a beautiful stage now where it's like we can actually, I mean, these concepts have been around for forever, but now it's like we're able to really, I think, integrate all the knowledge that we have along with the comfort that now exists, which is kind of why I want to touch more on the Xersizer, because that's a pump that you guys use primarily, right?
It is. It is the pump that we use primarily in the office. And as you mentioned before, it's sort of similar to the Bathmate, but this pump is really made for kind of promoting penile health and in our males.
Nice. And so like let's say, one of your clients, he's just getting into it, using the Xersizer. What would you recommend for him? Like, is it like 20 minutes a day, 30 minutes a day? Because it's more like a pump after the gym kind of thing. Like how is it that you go about recommending it?
So how I recommend it and how my patients use it are probably two different things. For my patients, most of my patients, they'll pump about 3 to 4 times a week when they're in the shower.
Mhm.
And then when they're shower, I tell them to kind of hold it for about 3 minutes and do 2 or 3 cycles of that. That's my
Nice.
regimen, which is what I use. That's been very successful.
Nice. And then you're guessing that guys are probably like, I'm gonna hang out here for about 40 minutes, or what do you
They
suspect?
want to hang out. They get knocks on the bathroom door, like, "Hey, listen, like I need that bathroom." But but just to what you said, when you're using a pump, you don't want to keep the kind of that erectile state for too long, right? Because
Mhm.
as I mentioned, there are some studies that looked at oxygenation of the tissues, And so, you know, for guys that say, I got to pump for like 20 minutes and hold it,
Yeah.
right? So when you're pumping for so long, your penis actually gets into more of a hypoxic state. That means that it's oxygen deprived, and we don't want that. So we do want to cycle the penis. We want the blood flow to go in, hold it, and then go out, right? So
Yeah.
we don't want to pump. So I get so many guys that come in like, 30 minutes, I'm up, and like I try to pump it as hard as I can and all these other things. More is not better, but consistency is really important.
Interesting. And I mean, to your point, it's that's one thing that I realized, but I'm like, I had to look up hypoxia because it happened to me where I was like pumping for too long and I got discoloration from it. And I looked into it, I'm like, well, why is my dick turning? It's turning different colors on me, man. And I mean, I'm kind of
Starving for air.
yeah, no. And then I'm like, oh God, this is all my doing. But I realized that afterwards, and I'm like, this is awful. But at the same time, you know, there are like different peels that you can do to kind of get rid of the dead skin and stuff. But that's kind of what I realized. I'm like, okay, more is not necessarily better. And especially to your point too, you got to give it breaks in between. But I find that with using water in the exerciser, I guess it's more comfortable and the expansion is better as well.
Yeah, so for you know, we in our practice we've used both, kind of more of a pneumatic device and then the hydro device, and so we find that you get less of kind of the like if you're over pumping, you get less of the bruising, kind of the petechiae, which are those
Yeah.
kind of little dots of redness on the penis, and so guys find it a little more comfortable. They all can also do it in the shower, right?
Yeah.
So, you know, with the other devices, you're setting time throughout the day, maybe you're in your office or whatever, but everybody takes a shower, right? And so
Yeah.
you bring it in the shower, you do it for a couple minutes, you can, you know, soap off, do it, you know, and then, you know, you do your cycles and then you can go about your day. So it's really convenient, and it's something that's easy to remember. It's kind of like your toothbrush being by your sink, right? So
Yeah.
instead of having your toothbrush by your sink, you have your pump right, you know, right near your faucet in your tub, you know. So it's a really good thing. It's really easy to remember, and less hydrostatic pressure and everything as the pneumatic devices.
Nice, nice. And I mean, I guess this pump is much like it's the same deal probably as a bathroom where you just kind of pump against the body, right? And then that's kind of what creates the vacuum seal and the internal pressure, right?
Yep. So you'll fill the pump with water. If you're in the shower, you kind of turn it upside down. If you're in your bath, you kind of allow the cylinders to fill, and then you're going to place it against your body, and then you'll do your pumping. You know, you get to a point where it doesn't have to be like the maximum erection, but you want your penis to fill, right? You want to get that blood flow going, and you want the expansion of the tissues. And then after a few minutes, you're going to let that, you're going to depress the device, and then it'll expel all the water.
Interesting. And the one thing you mentioned something there that's honestly I've heard it fought about on forums all the time, and people talk about their opinions. And I mean, you can check out all the different male enhancement forums, man, the Reddits, all that. But people always discuss like, is it better to go in with an erection or without an erection?
I think it's better to go in without an erection. I think, you know, if you have an erection, you're already getting good oxygenated tissues to the penis. And this is extra. This is exercise, right?
Okay.
And so what you're doing is in my opinion, what you're doing is you're just bringing that blood flow going in and you're taking it out. Right?
Okay.
When you have an erection, you're already kind of you already have kind of like a tamponade, so you're already kind of restricting the blood flow out, so you're not really getting blood flow in and out. The blood flow is just going in and it's staying in. That's what an erection is, right? Is
Yeah.
so an erection is more blood flow going in and hardly any blood flow leaving, so you're not really getting that flow that's in and out of your penis. So definitely for my patients, I always recommend that they're doing with a flaccid penis.
Interesting. And if you were to go again with like the erection, because a lot of guys that I've, read about on the forums, and this is obviously a hot topic, and they say that if you go in with the erection, this will cause more overall expansion leading to growth. Do you think there's any truth to that or no?
I don't think so. You know, like I said, I see a number of guys for a number of issues. And, you know, usually with PRP, you get some growth because you do have expansion of kind of the sinusoids in the tissue. And with a pump, you're going to get growth, but you're not going to get more growth if you're already erect. I've not seen that happen.
Interesting. Okay, well, that's good to know. I mean, Honestly, that's why we're here. Love learning about this stuff. So it's perfect for us. And the other question that I had now, in regards to the exerciser, as far as the sizing kind of goes, how is it broken down? Because I know there's only about 3 models, if I'm not mistaken.
There's 3 different models. There's an Xersizer, there's an Xersizer Pro, and there's an Xersizer Pro X, right?
Mhm.
But in terms of sizes, Cindy, what are the sizes?
Yeah, so the difference, so the Xersizer is kind of the basic model for a newbie who's never really used a penis pump.
Mhm.
It's very basic. It's only about $100 on the website. The Xersizer Pro comes with the attachable pump. So it's a little bit easier to pump if you have the handball and the
Yeah.
comfort insert as well. And they come in sizes 3, 5, and 7. Yeah, so I think majority of men are either 5 or 7.
Okay.
And if you don't know, on the website, you can kind of they'll show you how to measure it correctly to pick the right size.
Yeah, do this
Yeah, CJ, I
sizing.
think you
Yeah.
had called in for an extra order of the size like 12 or 15. Is that what you're calling? You wanted me to contact the company for that?
I wish, man. But even then, I'm like, if I did, I'm pretty sure my wife would have left me like, "No, this is too much."
I know.
Like, you reach your male enhancement goals at my expense. It's like, I'm out of here.
That's right.
Which is the one like psychological factor. Everybody's like, "Oh man, it needs to be the same." I'm like, no, it doesn't. Like, girth is kind of more king. But honestly, this is pretty dope. But again, yeah, you're right, because it's kind of, there you go, 3 to 9. So anybody listening, be sure to check out the website, which is a little bit, because one thing we were talking about off air, which is something that I found to be really true, and Cindy, I guess you can attest to this, that the bathmate size were a little bit too much, right? So the difference here is that it's more to the truth and more to the size that actually are out there.
Yeah, no, Xersizer is great. It's a new site that Bathmate just launched. And it's really about, focusing at younger men who want to exercise their penis. So it's not as overwhelming. Like I said, there's 3 products on the site to choose from, and they'll kind of, lead you through it. 60-day money back guarantee if you're not happy, and free shipping.
Yeah.
And
It's pretty dope though, because yeah, I'm checking it out right now as I'm talking to you. But it's pretty interesting too, because it's kind of like it has a different thing: the comfort inserts, the handball pump, warranty, and all that good stuff. So I mean, I'm loving it. I think this is something that I think this younger generation is more open to it too. Whereas before, I mean, I honestly, the only thing that I ever thought about penis pumps in the past was, I thought Austin Powers, like, that's what I thought. I'm like, Austin Powers had a penis pump and it's something like a novelty, and like there's nothing good about it. And even with, like I said, when I was researching into pumping back in the day, I thought it was almost like disturbing. I'm like, what are these guys doing? It seems like they're microwaving their dicks, right?
But I think that there's so many guys that have that reaction initially, and once they start pumping, and some of the guys they're telling me that they're getting more morning erections and their erection quality is better, and they're sold.
Yeah.
But you're right. It's just making that jump from, what is this thing, to, all right, this thing is part of my routine now,
Yeah.
and my sexual function is a little bit better. And so that's always kind of the response. For the most part, that's the response that I get.
Yeah, because I mean, it's almost like when you're doing something so foreign to like the body. And I mean, initially too, like my experience with it, like, because I remember, like I said before, I got the Bathmate X Pro Extreme or whatever with the hand pump and all that. Thing was so massive, I couldn't even get the suction down right for like the first couple times that I tried it, where I just gave up. I'm like, I'm going back to the air pump. But it's almost like when I first started using it regularly, when I started using, like, because I got a, what's it called, air pump that I use quite regularly. The first couple times, it had to be the weirdest feeling ever, and then it became an addiction. It's like, oh my gosh, what's going on? You see the expansion, you're like, oh my, like, I am a god, like, it's awesome. And then all of a sudden it's like, you get stuck on it because you're like, I want more expansion. And eventually over time, you just start to realize that you got to regulate it, and it is helpful, but you just kind of have to have the proper routine, proper things in place. But I was going to ask you as well, do you think it's beneficial for guys to recommend it with supplements like L-citrulline or anything?
So yeah, so I use a lot of nitric oxide supplements, and the two that we all think about it's gonna be L-citrulline and L-arginine.
Yeah.
L-citrulline is my favorite. When you take L-citrulline, it gets converted over the L-arginine, and it's more bioavailable if you take the L-citrulline as opposed to ingesting the L-arginine. So, all my nitric oxide supplements, the base at least, it's going to have L-citrulline in it.
Interesting.
So I do recommend, nitric oxide supplements. We usually use those nightly, so we kind of take it as a multivitamin every night.
Interesting. And that's something that you recommend nightly then?
For my patients, I do, especially for my patients that are having some erectile issues. For guys that are young, that are being more proactive, if they're eating like a normal diet and it's pretty well rounded, then they probably don't have to take it. But when you look at nitric oxide levels across a guy's life, as guys get older, their nitric oxide levels go down. All right. And so, we do find it beneficial. Obviously, you don't want to take too much. So if in every supplement is a little different, so you want to make sure that you are following the directions on the bottle or the box, because once again, more is not better. So you want to make sure, because too much nitric oxide actually causes some other issues. So we want to make sure that we're following the directions and we're getting the recommended dose.
Interesting. What are some of those other issues? Because I can see people abusing it, like, just so as a warning.
What's that?
What are some of the other issues that could be caused from like taking too much L-citrulline?
Yeah, so you can have some dizziness, some nausea if you're taking too much. You can have some blood pressure issues as well, because don't forget it is a dilator.
Yeah.
Right. And so if you dilate your blood vessels too much, you can get some dizziness, and then you can have some problems that way.
Jeez. So it's kind of, oh God, I think it's when you take Viagra too, there's some people that have that adverse effect to it as well, right? Where it's like they get dizziness and they kind of feel nauseous.
Yeah, so Viagra, I mean, the reason for that is a little different, but yeah, so you can have some nauseousness, you can have some dizziness. Also, for Viagra or Cialis, any of those other things, it can affect you can get some tinted vision in your eyes. You can have some heart palpitations. Some other, if you're taking too much of it, or if you just, for some guys, they just don't respond well to it and they just have a little more side effects. So, I always start with my guys a little bit lower. We just kind of test it out, and then from there we can increase the dosage, or if they're having side effects, then we can just change them to a different medication.
Interesting. And the other question I
But
had in
once
regards to
again,
that.
like I said, it's really about. I'm sorry.
No,
No,
yeah,
go ahead.
go ahead. Go ahead. Go ahead. Yeah, I want to hear this part.
No, I was going to say that, but like I mentioned before, it's really important that we do a full workup on these guys, so we know if Viagra is going to be effective for them, right? Because Viagra may not work for everyone.
Yeah. And I mean, the one thing, because obviously the Xersizer would play into that too, because if you're using a combination of different things, that's kind of, it's perfect because it's leading to, the next scenario that I kind of had in my own mind was, let's say somebody is taking Viagra, you add the Xersizer, it's still relatively safe to have the Xersizer being used in conjunction with some like Cialis or Viagra for a guy that, has to get back into penile shape, I guess. It is like two different factors that can play into, obviously improving his health per se, right?
So the good thing about the Xersizer or penile pumps in general is that the side effects are really low, right? You don't have to worry about the medications you're taking. You don't have to worry about like all these other things that you do with the other treatments that we give you. No infection, no surgery or anything like that. There are a few patients that we just have to be a little more careful with for guys that are using pumps. Those are guys that have sickle cell, right? And those are guys that have recurrent like erections, right? Because for sickle cell, you don't want the blood flow to stay in the penis for that long because they can have a problem. Or for guys that there's some guys that have like recurrent erections for unknown reasons, and we don't want to do it. We don't want those guys to be on pumps. But in general, it's very, very safe. For guys that are on blood thinners, we tell them, don't pump as hard and just kind of be a little more careful. But outside of those patients that I just mentioned, I mean, it's very, very safe. And like I said, hardly any side effects. And you can use it with Viagra. You can use it with injections. You can use it with all these things. But you should really talk to your physician. I'm going to kind of put that disclaimer out there. Like if you're using it with some of these other things, especially medical, you got to talk to your physician before you do that. But with Viagra, usually it's fine.
Yeah, interesting. And it's one of the things that, I looked into like sickle cell anemia where people are talking about how priapism affected growth. And some guys on the forums were looking for ways to actually like get self-induced priapisms by injecting different things into their penises.
No, you don't want to do that. No, that's a no. No, you don't want to do that. Yeah, because priapism, you can scar your penis, and then you can have permanent erectile dysfunction. So you don't want to be in a priapitic state. You definitely don't want to do that.
No,
but
go ahead.
I know, but it's amazing how, there's so many stories out there, and and it's just a function of how guys really want to just maximize their penis. Listen, they're going to do a priapism, they're going to hang from a ceiling, they're going to do all these things just to improve the health of their penis. And so it's really important that obviously that they do the right thing, right? And then if they're doing exercises, they do the right amount of exercises. But it's good that, we're talking about it, because then we can kind of dispel some of these myths, and we can say, all right, well, this is something that maybe you should do, but for priapism, definitely we don't want to, for the record, do not induce a priapism. No.
Oh man. Cause to your point, man, I've seen all kinds of craziness where like some things I'm just like, that's too unbelievable. I don't think that's real. Like I've been on Reddit where some guys are just talking about like some of the craziest things out there, but they're like, yeah, man, it's gonna work. I'm like, I don't think so, man. If anything, you're just gonna destroy your salami, bro. But it's like everybody's always looking to experiment, go full mad scientist. And I'm happy that you're here to say, hey, you know what, a little bit, tread with caution. You don't want to be playing around with your dick health for the rest of your life, and then eventually have to go see a urologist like, all my nerve endings are fried. My dick doesn't work. Want to avoid that at all costs, man.
Throughout the years I've seen a little bit of everything, and it's nothing wrong with a little bit of experimentation. We love, like for me to say somebody's not to experiment, I think that's wrong. But when we're going a little bit above and beyond, I think it's just something we have to be careful about.
100%.
And it's really important. I love Reddits, because then hopefully you can get other people's opinion and things like that. And there's guys like you that are on there saying, hey, listen, don't do that to your penis. Please don't do that to your penis.
So, check out the Masculine
really
Health
important.
Podcast.
Or you see exactly. Or you see a specialist, you see somebody, and you see somebody that really loves doing this and loves talking to people and has a wealth of knowledge. And just find somebody that you can really trust. If it's it doesn't have to be a urologist, somebody that really understands the field, and that understands the direction it's going in terms of like the technology that's out there, and really willing to just sit down and talk to you about your penis, right? Who like just talk, and somebody to kind of bounce things off of, I think is really important.
100%. Because you know what, it just kind of comes down to dispelling the myths, getting rid of the taboo, and just say, hey, it's just like another part of my body. And when I started looking at my dick that way, I'm just like, you know what, man, it's just like training the bicep, and when I train my bicep, I'm not looking to maximize it in one day and try to get like I don't know, like let's say I inject something into my arm that'll keep it pumped all day and just I'm like, yes, it's gonna grow. It's like I don't really think it works like that. After years and years of bodybuilding, I'm like, this takes time. And I'm like, when it comes to improving your rectal health or your penile health or your mental health, any aspect of health, I just kind of came to realize you can't really shortcut the body. And even though like I'm into biohacking and obviously I want to be into the preventative side of things, I've just kind of come to the foregone conclusion that, you know what, when it comes to the body, you got to give it time. You can't force these things to be overnight. As much as I would love them to be, it's like, you just got to give it time. So it's kind of with your pumping, like you said, one of the biggest things that I think is a key takeaway for anybody is to be consistent, but not do too much. Like you don't need to sprint every single day. It's a marathon, right?
Yeah, exactly. And I think that's a great analogy that you brought up. Just kind of, it's sort of like working out, right? It's if you don't go to the gym like a couple times a week, and and then if you have a hiatus and you come back like in 3 or 4 months, you're gonna feel it, right? It's not gonna be the same. You're not gonna have the same muscle tone. So the same thing with your penis, especially as you get older, you gotta be able to use it. You gotta be able to sort of exercise it, get that blood flow going there, and you want to do it regularly. You just don't want to kind of once, like, do it once every 3 or 4 months. You want to make sure you're focusing on it and really make it part of your routine.
Yeah. And I mean, to close off here, I want to just hear like a success story of maybe one of your clients that came in, maybe didn't know anything about the exerciser, didn't know anything about pumping, completely oblivious to all this stuff, and how you were just able to come in with like a good protocol and just help him out and just change his life in regards to his penile health.
One of our patients? You mean all of our patients? What do you mean? One of them. I got so many stories.
Yeah.
We needed another hour for this podcast to talk
That'd
about the great things that we do.
Rockwell Institute.
So I see a number. So I see patients like, every day, and everybody's got a different like reason why they're there, especially for their penis. We always talk about, that lifestyle and exercise is really, really important when we're putting a program together, right?
Mm-hmm.
Really important. And then it's always this give and take on terms of what you want and versus what we can do, right?
Yeah.
And there's some guys, their expectations are crazy, right? So there's a guy that came in the other day and he went to a urologist and says, you need an implant, right? And he's like, Doc, I want you to fix me so when I look at a woman, I get an erection. I don't need anything. I'm like, well, we got to figure this out. Let's take a step back. Let's do an evaluation. Let's figure out, we can get you better, but let's see how much we can get you better.
Yeah.
So, and part of almost all of my regimens in terms of what I do for the penis involves a penis pump, right? Because like I said before, there's no side effects, right? It's something that we're focusing on our penis. We're exercising the muscles of our penis, and it's really helping to be a good adjunct, or it's helping to coincide with everything that we're doing. So I use it for all of our regimens. We find that guys that use it, as I mentioned before, either with some of the other treatments or by itself, they're getting a more fuller penis in general. They may be getting a little more length depending on where they are. But they're focusing on kind of penile health. And for those guys and almost all the guys, they're getting some result out of it.
Yeah. Which is awesome, because it's kind of like, as a dude, what more could you possibly want when it comes to your penile health? Bigger, stronger, and it works to a T. And it could always get hard. So that's kind of one thing that, obviously
it works when you want it to work.
Exactly. That performance factor, because it's huge. And I mean, like what you're doing is honestly changing people's lives, because I think a lot of guys, when it comes to the mental side of things, because I get a lot of guys that reach out to me, and I never had this issue. I think there was one time though where I was doing too many Kegel exercises. I gave myself premature ejaculation, so it did kind of mess with my head a little bit. But other than that, I've never really had to deal with it from a psychological perspective, where there are guys where it's like mentally it does really mess with them. So what you're doing there is God's work, because hey, you're helping them to just kind of overcome this and live better lives, where it's like, I don't have to worry about this. My body's working perfectly fine. So I love what you're doing. And if you could just tell us where we can find you and more about the Rockwell Institute, man, and all that good stuff.
Yeah, so my center is Rockwell Centers for Sexual Medicine. We're in Philadelphia, New York, and the Poconos, Allentown, Pennsylvania. My handle is at Dr. Gittens. You can see me on Instagram. I'm not great with social media, just so but Instagram. We have some things on TikTok. I'm trying to do a little more TikTok, probably like Facebook or something. But you can go to our website. It's rockwellcenters.com. And we treat men for any type of sexual problem, not just ED, premature ejaculation, not ejaculation, pain with ejaculation, male infertility. And we also treat women for sexual dysfunction as well.
Damn, man. So much more to could have touched on, but they need more time for sure. And Cindy, if you could tell us more about the Xersizer, where we can find it, the website, all that good stuff.
Absolutely. So the website is Xersizer.com, and it's Xersizer.com. And like I said, it's an easy website to get through. And we hope people check in and take a look at it and, start exercising their penis.
Yeah, for sure. I mean, it's like I said before, we want to make sure that every aspect of men's health is always taken care of. And that's what this podcast is all about. So, all the guys listening, I hope that you guys were able to take tons of information from this episode. And again, be sure to check out all the links. They're always in the description. So, until the next episode, and I just want to say, hey, Paul, Cindy, thank you so much for coming on the show today and for having this discussion with me.
Thanks, CJ.
Appreciate it.
All
a
right.
lot of fun.
Oh, yeah, definitely. I'm going to have you guys on again. We got to do this again. All right. Until the next episode, we'll see you then.